Hi everyone, I am Dr. Bensley Gonsalves. I am a consultant diabetologist at Bliss Diabetes Center in Vasai. So I'll be talking about diabetes with hypertension, especially in this COVID pandemic. So what one needs to know is a person with a diabetes may develop complications and a severe COVID disease if one gets it. Over and above that, if a person with diabetes is also having hypertension and heart disease, the situation may get critical. So you or me don't want to get into such a sticky situation. So I will be giving some tips for control of diabetes and hypertension, especially during this COVID pandemic. First and the foremost, do not stop taking your medicines. Take the medicines even if you are not having any symptoms. Of course, it will be better to have a timely check with your doctor, either by video consulting or visiting to the office. But don't stop taking your medicines. Keep a watch on your blood pressure, your blood sugar, and your cholesterol timely. Various factors can contribute to changes or increase in the blood pressure, especially sometimes we are used to taking these over the counter drugs. Like in this season we take the cold, cough and the flu medicines, decongestants, then NSAIDs or painkillers such as ibuprofen, naproxen. So one has to be careful because these drugs may increase the blood pressure. uh, Patients with heart disease have to avoid such painkillers because they may have direct effect on the heart. Some prescription drugs like corticosteroids, oral contraceptive pills, uh, some cancer drugs, some mental illnesses drugs, uh, immunosuppressants can trigger high blood pressure. So they have to be taken under supervision of a doctor. Alcohol and caffeine both have to be taken in moderation. Caffeine, no more than 2 cups per day of a caffeinated drinks. Certain herbal remedies like herbal preparation containing licorice or certain Ayurvedic laxatives may contain salt or rock salt, which may trigger high blood pressure. Then eat on time, have small frequent meals, hydrate well, keep a watch on the salt intake, especially the hidden salt which is present in the packed food or junk food. Then manage stress well. One has to take care of stress because stress may lead to all sorts of bad habits like binge eating. Then there may be decreased sleep, poor diet, poor choice of diet. These all can increase the risk of blood pressure. Then stay active and engaged. Don't be sedentary. Even if you're working from home, have uh, timely breaks for stretching out and doing some kind of a physical activity. Always have extra medicines at hand, especially if you are living in a area of lockdown. See that you have a good quota of good stock of your prescription medicines. And nowadays it is much easier because medicines are available online as per the prescription. uh, you have to recognize hypertensive emergencies or crisis. If the blood pressure is above 180 systolic and 120 diastolic, one has to be careful. Look out for signs of throbbing headache, then uh, chest discomfort, breathlessness, blurring of vision, or difficulty in breathing or speaking. So one has to consult a specialist immediately. If someone from your household has contacted COVID and is in home quarantine, make sure that appropriate appropriate person who are at less risk of contacting COVID take care of such people, and ensure that separate bedroom uh, is allotted to the patient, so that that patient or is not in contact with the other members of the family. Make sure that everyone follows a good hygiene, covering their nose and mouth while sneezing or coughing, then repeatedly washing of the hands, then at least once or twice mopping of the surfaces with disinfectants. Then set up some basic rule for to make sure that the person who has got COVID gets his or her food timely, his or her medicines timely, without having much contact with the people around. So hope this information was of help to you. Thank you.